Welcome back. In the previous video, we broke down the weeks of the first trimester, and now we'll talk about the second trimester. During week number 14, the baby has fully developed eyes, which are covered by fused eyelids. It also has tear glands and fully developed vocal cords, so it can technically cry. We can also see the first sign of sucking the thumb. The nails will also start growing. The fatigue will finally start wearing off, and the mother will have more energy during this time. There will also be increased appetite, and the mother's hair will grow longer, thicker, and darker. During week number 16, the fetus is already 50 centimeters in length. Just kidding, it's about 14. It will have eyelashes and eyebrows. The tongue will develop the taste buds, and you should perform all the second trimester screening during this time. All the patient's tendons and muscles will relax, and this relaxation will continue till delivery. Because during delivery, you want the muscles and tendons to be relaxed, so the baby can exit very easily. But because of this relaxation, there will be back pain, especially in the lower back area, and the rising hormone will cause largening of the breasts. There will be also constipation, and increase in the production of the oily glands, which are mainly found in the face. So the pregnant mother will have the classic glowy skin appearance. During week number 17, the fetus is rapidly growing, and the amniotic fluid around the baby is also increasing. So the patient will have drastic increase in weight and stretch marks. During week number 18 and 19, the baby structures are very clear, so we can do an ultrasound to visualize the baby. This is also the best time to check whether or not you have twins pregnancy. The placenta is also clearly visible. The baby can also have hiccups, which is very interesting. The patient can have swelling in the hands or feet. The back pain will increase. There will be leg cramps and varicose veins. During this week, the baby is growing stronger and kicking harder. During week number 20, the fetus is about 21 centimeters in length. The ears, as well as the ear canals and the inner ear, are fully developed, and it can hear muffled sounds from the outside world. The genitalia is now fully developed, and it can be distinguished by ultrasound, so we can easily know the gender during this time. There will be indigestion and heartburn, leg cramps, swelling of the hands and feet, but mainly in the feet, and vaginal discharge. During week number 21, the uterus finally starts contracting occasionally, and this is known as false labor, or Braxton Hicks contracts. These are completely normal, and you should not be worried about them. Keep in mind that these are irregular and occur at various times. Unlike actual contractions of labor, which are regular and occur at strict specific times, like 5 or 3 minutes apart. The real contractions are also much stronger. There will be more heartburn and indigestion, leaking of small amounts of milk from the breasts, dry skin, and stretch marks. During week number 22, the fetus is growing larger, and this causes outward protrusion of the umbilicus, so the belly button will be everted. There will be more stretch marks and more back pain. During week number 23, there will also be more back pain, more Braxton Hicks contracts, and more swelling of the hand and feet. During week number 24, the baby's eyelids are now separated into upper and lower eyelids, and the baby can open its eyes. Their lungs are also quickly developing, and we can see the first signs of breathing. Maternal symptoms include leg cramps, more back pain, and more stretch marks. During week number 25, you will have more energy, but also more symptoms. These include constipation and hemorrhoids, frequent urination, bloating, heartburn and indigestion, and of course increase in the frequency of the false labor contracts. Week number 26 is the last week of the second trimester, and we expect to see trouble sleeping, headaches, trouble remembering recent events, higher blood pressure, and more false contracts. So that concludes the second trimester, and in the next video we'll talk about the third and final trimester.